Hello, welcome to new episode of Medical Diagnosis. Do you have migraine? So many of you might be having headache and may be doubting that you have migraine or not. How to know whether you have migraine or not? There is empty number of causes for headaches, and you may be having a medical condition. Sometimes can be trigeminal neuralgia, which is facial pain due to the involvement of the nerve applying the face, and sometimes you might have a sinusitis which will present as headache mostly in the front of the head and in the morning hours calling it as an office headache, or you might be having something called as a tension headache where you might be having a band type of headache in the scalp. Basically in 2 or 3 weeks it may be coming and going. Sometimes it can be a surgical cause, such as a subarachnoid hemorrhage, where one of your vessels of the brain is breaking due to a swelling or an aneurysm, or it can be sometimes intracerebral hemorrhage, which can be the bleeding inside the brain cavities as well as brain parenchyma. Sometimes it can be because of a long-standing cerebral tumor thing on in your brain and causing the headache on and off. Have you ever thought of why your doctor is thinking about and diagnosing you with migraine even though all these causes are present? There is a simple clinical rule which I follow for making the diagnosis of migraine. We'll diagnose migraine when there is all these conditions present. You should have a headache of at least 4 to 72 hours and with no other physical examination finding and no other reasonable cause of the headache. And at least two of the following: if you are having a one-sided pain or a throbbing type of pain or aggravation by the movement or a moderate to severe kind of pain, and at least one of the following of nausea or vomiting, and the photophobia or phonophobia. The photophobia or phonophobia is if you are having difficulty in looking at the light is called as photophobia. If you're having difficulty while hearing noises is called as phonophobia. If any of these is there, or nausea is vomiting is there along with the features, then you can diagnose as a migraine. Thank you.